My name is Tim, and my role at the minute is within an organisation called an ICB. So that's an Integrated Care Board, and it serves an area of England, Bedfordshire, Luton, and Milton Keynes. And an ICB is like an organisation that coordinates, it commissions healthcare. So it sort of works out what services are needed for an area and then makes sure that those services are provided. Within that, my role title is Associate Director of Sustainability and Growth, and that means that I'm responsible for making sure that NHS organisations in this area become more environmentally sustainable, and they work to better support local economic development.
Hi, my name's Sian and I work with Tim at the ICB, and my role is Sustainability and Growth Programme Manager. I've been working with Tim for the last 18 months or so in the sustainability role, and I go out and I talk to primary care, which is our GP practices and dental practices and optometrists, about how they can reduce their carbon footprint. So I did a BTEC HND in Hotel Catering and Institutional Management, which sounds completely opposite to going into the NHS. But I ended up running pubs in London for 17 years. And running pubs isn't very good for your health. You get very tired. It's fine when you're young. So I left London and I moved up to Bedford, and I didn't know what I wanted to do then because pubs had been my life. And I just started going to a temping agency, and the temping agency put me in a position as an admin assistant in the NHS, working for the wound care nurse and the Parkinson's nurse. And I just kind of stayed, and I moved around, and I've been in lots of different areas. I've been commissioning ambulance services, I've been an exec assistant, I've worked with primary care teams, and then we went through a restructure a couple of years ago, and the opportunity came up to change roles. And I spoke to Tim, and he explained what we do and in our little team, and I just thought, I like that, I want to be part of that.
My route has sort of come full circle a little bit. So I studied chemistry at university. But having worked in the chemistry labs for a number of years, I thought, actually, this is something I want to get out of. I want to go into something a bit different. And I ended up in NHS management. They have a graduate management training scheme that I joined about 16, 17 years ago. I think the environmental side of things, sustainability side of things always was there in my thinking, sort of thinking, how do I reduce the amount of stuff that we need to use? How do we stop the waste? It sort of became more of a deliberate decision to move into this part of the NHS. Healthcare services in the UK produce about 5% of all of our greenhouse gas emissions from the whole country. And it's about 40% of the public sector's emissions come from healthcare as well. A lot of that is to do with the energy and travel that we need in order to deliver services, but also all of the things that we use. So all the consumables, all of the so things like gloves could be, or needles, it's medicines, anesthetic gases, MRI scanners, all the digital tech that we use, all sorts of things that we consume. They all have an environmental impact. And healthcare in the NHS has pledged to become a net zero healthcare organisation by 2040 for all of the emissions that it can actually directly control, things like energy, and by 2045 for the things that it buys in, all the things that are in its supply chain.
At the moment, one of the biggest challenges we've got, because as Tim said, our use of protective equipment, the gloves and aprons and masks, etc., went up during COVID. Our use of gloves went up 200% during COVID, and it's not gone back down. The threat of COVID isn't like it was when COVID started, so why we're still using all of those gloves. Medicines waste is a huge problem for the NHS and a massive carbon footprint as well. We waste £300 million worth of medication in this country every year. So again, that challenge with patients is to understand, do I still need this medication? Do I still need to order it? And what do I do with it when I don't want it anymore? You know, taking it back to the pharmacy so it can be disposed of properly rather than putting it into the bins.
Just to build on that as well, to think about its time. A lot of people in the NHS don't have a lot of time. Sometimes you need time to think, to do something differently. Otherwise, you have to just follow the things that you do every day in order to get through the day. And so part of our role is helping people have that time. Some of it's to do that thinking for them. And sometimes it's about demonstrating to people that if they just stop and pause for a moment, try something else, it'll actually save them time. A big amount of our emissions comes from our supply chain, the stuff that we use. I think I talked about that earlier. The things that we buy, the things that we use. And anesthetic gases are one of those things that we use. Many people will be familiar with those because in surgery, in pain relief, most people who go through childbirth will probably be offered gas and air, for example. Those gases have a large greenhouse gas profile. They are global warming gases, one of the largest. And that's not to say that we shouldn't use them, but are there alternatives that we can use? Or, you know, are there ways that we can reduce the amount that we're using? So one of the things that we have done within the NHS, and we've been at this position in Bedfordshire, Luton and Milton Keynes for a couple of years now, is to eliminate the use of desflurane. Now, desflurane is was one of the go-to anaesthetic gases for surgery, highly effective gas, but it had a global warming potential of over 3,000 times that of carbon dioxide. So what that means is that if you release 1 litre of desflurane into the atmosphere, that would be like releasing 3,500 litres of carbon dioxide into the atmosphere in terms of the amount that it would contribute to global warming. And there are alternatives out there. You can move to a different anaesthetic gas, which has a much lower global warming potential. And then there are people looking at how you can capture the gases that are released from that process. And then rather than releasing them into the atmosphere, you capture them, you crack them, which means breaking them up into their constituent parts so that you can then reuse those chemicals for new products. We're also seeing a government-led drive to think about how we reduce the impact of medical technology and how we make it more what they call circular. So when we're using a product, after it's been used, what happens to the materials in it? Can we break it down? Can we reuse those things back into another device or piece of technology? I think there's something about helping everyone understand that we as a whole society have a responsibility for this. It's not just down to people with sustainability in their job title. That's our job, to help people get there and understand that, but everyone has that responsibility. And you know, the healthier people are, the less that healthcare they're going to need. The quicker they recover, the less healthcare they're going to need. So there's a sort of large part of our role is not just thinking about how the hospitals deliver their services, it's how do we help our populations, our residents, our patients stay healthier and get better quicker, because that in itself is probably going to have the biggest impact on how much resources we use. I think the sort of skills that have been really important have been both that sort of constant thinking about the environment, because it's, you know, it's important to us living healthily. We rely on the environment to provide us the materials that we need to use, so we need to care for it in that way so that it continues to do that. What we call continuous improvement is another sort of skill set, sometimes called quality improvement, that I found myself using and learning a lot about in my career. Basically, at the core of that is that mistakes and failures aren't actual mistakes and failures. They're just something to learn from and change what you do as you go forward, which is actually really helpful in terms of this field, because it's not straightforward, it's not linear, you don't make progress every day. So that's been incredibly helpful.
Coming into healthcare, it's been a revelation for me. I came from a private background in the pubs, and then I came into the public sector in the NHS, and it's been a revelation and really interesting. And I think the thing about the NHS is you can move around. You can get your experiences as you're going around, and you can go sideways, you can upwards, downwards, whichever. It's a good place to work. It's ever changing. It is at the forefront of innovations and just some really exciting stuff out there. So if you do want to come into the NHS, do.